is one of the first things people notice, but for someone who has one or more missing teeth, smiling is something to avoid. Prosthodontist Dr. Almasri, he's with Dental Solutions, says dental implants can restore that smile, and the first step is a 3D CT scan. Doctor, how are you today?
Good, thanks. How are you doing?
Okay, let's start, Riyadh, with what a 3D CT scan is.
3D CT scan is a three-dimensional X-ray that shows you the vital structures, the bone, in 3 dimensions. Back in the days, whenever we looked at X-rays, I'm saying back in the days, a few years ago, we looked at X-rays in 2 dimensions, as in we see height and width. Now with the 3D technology, we can see height, width, and depth, so we can see inside where your vital structures are at. So it's very important to see what's going on before you place the implant, so you can predict if you need any sinus augmentation, as in sinus graft, or if there's any nerve that you're going to be doing any damage to before you place the implant. It's very important to have it prior to implant placement. Yeah,
I'm sure it changed your business completely, being able to do the CT scan before you plant the implants in, because you see all of what's going on in that mouth before you get in there.
Yeah.
Okay, all right, let's look at the monitors here, because I want you to walk us through what you're seeing on a CT scan.
All right, so this is a patient model. You can see the bone in 3 dimensions. That purple line, that's one of the nerves, and it's very important to see the nerves and where they're at. And you can see between those 2 teeth, there's a missing tooth and there's an implant. That's a plant implant, and it hasn't been placed yet, but we're planning to place it. And you can see how far is it from the nerve. So that nerve actually supplies sensation to the anterior lip, right side. So if you place the implant and you pinch that nerve, or you cut it or you injure it, you're going to have loss of sensation. Also, in this implant, see, it's very close to the sinus, and if you go further inside the sinus, you're going to have sinus complications. So you need to be aware of those things prior to implant placement.
Okay, and it's important to note for people who are considering coming in, you're the only doctor in the office. They're going to see you, and you warranty your work.
Yes, we do.
Talk about the warranty.
Well, we use a great implant system that if they warranty their implants for life. So if the implant fails at any point in time, we'll replace it at no charge. That's how confident we are that this works. So
that's great.
Anyway, so you can see here also in this section how the implant is placed and where the nerve is at. And you can see all 3 views. On the right lower side, you can see the axial view, and the middle one you can see cross-sectional, and the left side you can see frontal view. And you can see also the nerve that runs down under the implant.
And Riyadh,
how far is it from it?
And I want to say, patients, when they come in, they're going to see you personally when they come in for that consultation. I think that alleviates some fears too, knowing they're going right to the top, the only doctor that's in there, to see their personal case and consult them on it.
Yes, absolutely. Whenever they come in for the consult, they'll see me, and we'll sit down, we'll do the consultation and the CT scan, and we'll explain to them all the things that is involved in implant placement and the process and what they need to be aware of. When I tell my patient, anything before is an explanation, anything after is an excuse.
All right, I like that motivation. Any specials for GMT viewers today to motivate us even more?
We'll do a complimentary consultation and the 3D CT scan at no charge.
Fantastic. All right, thank you, Doctor, so much for bringing this to
GMT
today. And if you want more information, call Dental Solutions at 214-521-5900 or log on to this website. It's fastnewsmile.com. Carrie?